They don't trust anybody anymore. They don't want to take any products.
I know.
Do you find that you...
I don't have that problem. My patients, the reason they don't take drugs, they don't like the side effects. But there are no side effects to vitamins. I mean, they're minor. And so patients will take the vitamins, but they won't take the drugs. And my patients, I explain to them what I'm trying to do. I explain what they have and how we're going to work together, and they trust me. So my patients have a pretty good track record of going along with the treatment.
And they're lucid enough to comprehend what you're conveying to them?
At first not, but later on they become that way.
So how do you get them to start the program at the beginning?
Well, if they're really psychotic to that degree, they do have to have medication to control their psychoses, but they usually come along with their relative. If it's a son, they come with their mother. I'll give you another example. There was a young man from New York City, came here with his mother. He'd been sick for 2 years. He'd been in the New York State hospital system for 3 different times. He and his mom arrived here about 4 years ago. And he sat there and she sat there. And he was there in body, but the soul wasn't there. His mind was blank. He was empty. He was at a huge dose of a very strong drug called Clozapine. And so I got all the information from his mother, nothing from him. He couldn't tell me anything. But she was a very good woman, and she looked after him. They told her in New York that he would never get well, he'd never finish university, he'd never get off medication. Well, after, right now, 9/11, you remember what happened in New York, 9/11? Which is about a year after I first saw him. He was so much better that he was a volunteer helping direct traffic in New York City. Right now, he's finished university, he's got a girlfriend. We still haven't got him off the medication because it's very tough to get him off these modern drugs. They're terribly addictive. But we have his Clozapine down from 600 to 200, and the big problem now is to get him down to 0, and that's been really hard. So it depends on the patient, but the main thing is that if you start treating a schizophrenic patients, you can't give up. You have to work with them until they get well.